how is a person classified as fully vaccinated? Is that happen before the booster, after the booster? What?
Yeah. So fully vaccinated does mean that you are fully vaccinated before the booster. So the primary series is considered the vaccination series. So if you've had the first 2 doses of the Pfizer or Moderna, and you've had the single dose of the Johnson & Johnson, after 2 weeks after the last dose you've had, so 2 weeks after the second dose of Pfizer or Moderna, and 2 weeks after the first dose of the Johnson & Johnson vaccine, one is considered to be fully vaccinated. But as the initial data that I showed in the first slide, we see that there is a fall off in that efficacy, and that's why the booster doses are being recommended, because of that fall off in efficacies in that. But if you completed the primary series, that means you're fully vaccinated. Now, keep in mind the primary series may also include the third dose for patients that have certain medical conditions that are immune compromised.
A question we get quite a bit is if someone unfortunately does get COVID-19 and they have been ill and they haven't yet received their booster shot, how long do they need to wait between feeling better and getting a booster shot?
Okay, yeah, that's a great question. So if you have a current COVID-19 infection, then the vaccine should be administered after recovery from the acute illness if symptoms are present. And there are certain criteria that are listed on the CDC that you can see for isolation. So essentially, if you have a current infection for COVID-19, the main issue is that you have the propensity for spreading that. So you become an infective agent, so to speak. So it's important to stay in isolation whilst you have that early signs and infection that is active. If you go out to get a vaccine or out into the public anyway, you have the risk of passing that on. And so this is why if you have a current infection, we don't want you to be going out into the public to get a vaccine.
Do we know how much protection the booster can really provide us?
Yes, so the booster is, it's unclear how long that booster lasts, but it does improve the protective response after 5 months. So if I can quickly just go back to a couple of these slides
Absolutely.
that I had earlier. So this is a slide that will show you what happens to some of the efficacy in outpatient and inpatient settings with the Moderna and Pfizer vaccines. You see up to dose 2, there's that reduction in efficacy. And then after the boosters, you can see this efficacy does bump right back to where it was at the start of the second dose. So there is this waning effect after you get the booster. This does bump right back up to where you should be after the booster shots. And this is for the Moderna and Pfizer vaccines.
Okay.
So it's important that we acknowledge that the boosters do have an effect. They do have a positive effect in really improving your protective response.